Welcome to the Bronchiectasis and NTM 360 podcast, where we're here to share valuable insight from leading health experts, heartwarming stories from people living with bronchiectasis and NTM lung disease, and the latest in health research and treatment. Please subscribe, follow us on social media, and visit bronchiectasis and NTM360.org to learn more. Just a quick note before we get started. This podcast series is intended for educational purposes only and is not a substitute for medical advice. Please consult with your medical provider if you have any questions. Welcome back to the Bronchiectasis and NTM 360 podcast. It's so great to have John Torrence here with us. He is the patient ambassador for Bronchiectasis and NTM 360, and we're going to be looking at the different testing that might be involved with diagnosing bronchiectasis, and specifically, John is going to go over what his experience was and his journey to diagnosis. So John, could you just tell us a little bit about what prompted you to get tested for bronchiectasis?
Sure, and thanks for having me, Alyssa. It started with a cough, and I didn't know what was causing it, and I didn't have any reason to suspect it was something major. So I assumed I had just gotten a cold or a flu. So I just kind of went through the cold and flu cycle of a few weeks, and when it didn't go away, I finally realized I needed to take a little more action. I still wasn't convinced I needed to go to a doctor or a medical institution. So I tried changing things in my environment. I thought maybe I had allergies, or maybe there were some toxins or dust in the air, maybe something about my work environment. And I kept experimenting with things for like 2 years. And over that time, slowly the cough got worse and other things started happening, and I didn't put it all together that there were other symptoms going on at the same time. And finally, after 2 years, I finally went to a doctor because I obviously wasn't doing it very well on my own. And they, treated me generically for pneumonia with a little bit of antibiotics a couple times. It kept getting more significant, the cough. And by then I could tell I had a lot of fatigue. And so about my third major visit to the clinic, they got a little more serious, and then they started escalating me into pulmonology. And that's when I started really getting treated.
So you had seen a regular primary doctor, and then they escalated you to see a pulmonologist. How long was your experience between seeing your primary care physician or provider and then seeing a pulmonologist?
So the first primary care physician was in May of 2011. And again, that doctor gave me a short dose of antibiotics. And then it took me a while to realize that things hadn't gotten better. So I went back. I saw another doctor in August of 2011. So that's 3 or 4 months later. Same routine, different kind of antibiotics, but same lack of results. And then it was December of 2011. So again, another 3 or 4 months. And the key at this point was by this time I was getting emotional about it. So rather than being calm, cool, and collected, I went in and I was upset. And I think the doctor sensed that I was finally invested in this situation. And maybe that kind of piqued their interest a little bit more. And that doctor found what she called a nodule on my x-ray. And that was the thing that started pushing me up into pulmonology.
Yes, definitely being your own advocate is so important. I tell patients all the time that if you feel that something is wrong and you're not getting answers, to seek a second opinion, and that's okay to do that. No one will be your advocate like you will be for yourself. So sometimes looking at the symptoms, looking to see what other tests can be involved, looking at your family history, all through a new set of eyes, might be just what you need to get your answer. The gold standard to diagnosing bronchiectasis is a high-resolution CT scan. A high-resolution CT scan uses advanced technology to create detailed imaging of the lungs. A high-resolution CT scan is more sensitive than a traditional CT scan, and it actually can be used to detect subtle changes within the lungs or wherever it's being looked at. So, what is your experience, John, undergoing this type of test? And were you nervous? And how did you prepare for it? And what did it all involve?
Yeah, that test went, very well. Essentially, I mean, sometimes they don't want you to eat beforehand. Sometimes it's okay. I don't remember that particular one. But, just show up, and the technician there was very kind and tells you what to do, and you just lay down and listen to the directions. So I found that to be a very easy test.
So pretty painless.
Oh, completely painless. And again, they know that you're in an uncomfortable situation. So the technicians are generally very accommodating.
Another test used to diagnose lung disease is something called a pulmonary function test, or PFT. And the importance of this is to help measure the function of the lungs, how well air is getting in and out of the lungs, and how well oxygen is being absorbed. Providers typically track lung disease using this test. They also look at outcomes of treatment, so how well medication is working for you, and they can look at progression. This test can be hard because it requires a lot of effort, and sometimes it can be uncomfortable. It is tricky to understand some of the directions, but the people who perform these tests with you, they're respiratory therapists, they're very well rehearsed in how to coach through these tests. You can take breaks, and really they just ask that you give the maximum effort that you can possibly give. So John, what was your experience with this test? Did you have any sort of challenges completing this test?
Well, that test is much more significant and much more interactive, because it's a series of, different types of breathing. And some of the exercises seem quite complex to me. The technician will give you this thing to stick in your mouth and put something on your nose to make sure all the breath is coming out through your mouth. And then there may be 4 things they want you to do in a row. And I have a hard time remembering, okay, what's the whole order? But they're very kind, and they work with you. If you don't do it exactly right, they always repeat each exercise 3 or 4 times to make sure they get good samples. But I will tell you, I'm usually exhausted after a pulmonary function test, and a lot of times they'll also combine a 6-minute walk test at the same time. So that's the one test that will drain me.
Thank you for that, John. A 6-minute walk test is a test that measures how activity can affect your breathing and your oxygen levels. It involves walking as far as you can on a flat surface for 6 minutes, and this test can be used to qualify a person for oxygen at home. So if a person gets a result or a saturation of 88 or lower, then that qualifies a person for having oxygen with activity or with rest at home. Another test used or commonly used in bronchiectasis is having a sputum test or a sputum culture. A sputum culture involves collecting a sample of mucus from the lungs, and they use it to examine under a microscope to identify any sort of bacteria or fungi or any microorganisms that may be causing some sort of infection. What importance did a sputum test have in your journey?
I think the sputum tests are critical, based on what I've learned along the way. And typically in this environment, especially when they're testing for NTM as well as the bronchiectasis, they'll actually give me 3 cups and have me submit sputum samples on 3 different days, either 3 days in a row or 3 days of the same week. And then they're comparing all those in the laboratory. The key is that in the beginning, especially when I was just going to a local clinic, they don't give you much instruction. So they essentially say, spit into the cup. And now I know we need to work really hard to be bringing something up from our lungs. To, don't just spit whatever you happen to have. And so there is quite a bit, to the sputum test, but I think it's critical, and it's important that we get it done. And unfortunately, sometimes the local labs, may not be real familiar with how to handle a sputum test. So I've had times when I submitted the test and then the local lab mishandled it or something. So, it's a challenge, but I think it's really important.
I think that a sputum test sounds like it would be relatively easy, but there's really a technique to it. As John had mentioned, it's important to get the mucus from the lungs, but not the mucus or the saliva from the mouth. There are different ways to provoke mucus if you feel like your cough isn't quite productive enough. So in that case, just talk to your provider or to your respiratory therapist about that. In some cases, a provider will want to get a better look at what's going on in the lungs through a procedure called a bronchoscopy. A bronchoscopy puts a small camera into the airway to look around, and they can collect samples and tissue. They can remove debris that's in there, and this test can be used to aid in diagnosis. John, have you had a bronchoscopy before?
I did. As part of my first round of diagnosis, they included a bronchoscopy. And that was obviously a more invasive, more involved test. I was a little bit naive going into it. I knew that they were going to stick a camera down my throat, and I thought, how exciting this is going to be. I'll get to see. And I even asked, will I be able to see what's going on? They said, you will. And I totally don't remember anything. And then they said, well, we give you a special medicine so you won't remember the procedure. So I didn't feel any pain. There was some discomfort. They sprayed some, I think it was lidocaine down my throat to make it easier to put the camera down. And again, they explain everything. They're very accommodating. But it does kind of eat up your afternoon.
When you were going through your testing, did you find that any of the test results were surprising to you?
No, the outcome was completely surprising because, again, when you start down this path, at least for me, I really didn't anticipate that the answer was bronchiectasis and NTM. When they first saw that nodule, the doctors were leaning towards lung cancer, and they were looking to eliminate that. And only once they eliminated that, they started looking for other things. So I didn't know what they were looking for. And in retrospect, what I wish they had done was ask me, and maybe they'd have to ask me several times, what family history do you have of lung disease? You know, who else in your family has an issue? Because when they finally told me about bronchiectasis and NTM, my mom had that. And it's like, I would have told them, but for some reason it didn't occur to me. I knew she had this weird lung disease that was very rare, but nobody had told her there was a genetic component to it. So I didn't think to say anything, I guess. So to me, that was the surprise that, I remember when the doctor called to say, you've got this very rare condition. We don't know where you got it. And all the words he used were very familiar to me because I'd heard it from my mom.
And now you were diagnosed with NTM first, right? And then you were diagnosed with bronchiectasis?
Yeah, that was a bit of a funny story. When the doctor called, he actually said, you have this NTM, and he gave me all the long words, the species and everything. And that's when I thought, I have to call my mom because, again, I know she had some weird lung disease. This sounds familiar. And it was my mom that said, you need to ask the doctor, do you also have this other thing called bronchiectasis? So when I went back to the doctor, I asked him, and he looked in the computer and he spent some time searching. And at the end of the appointment, my review sheet said I had bronchiectasis, but perhaps he wasn't really looking for that. I don't remember it showing up as a statement on the CT scan results or anything like that. And so maybe back then the doctors, weren't as aware of bronchiectasis as they are today.
Yeah. So how has undergoing these tests changed your perspective on your health? I know that you are patient ambassador for Bronchiectasis and NTM 360. Could you just tell us a little bit about what got you involved with the foundation?
Well, sure. And you hit on the point early on in our conversation about being an advocate for yourself. And it's a point that I think is critical once you get to this kind of health situation. And it's not the way we were raised, candidly. We were raised that you go to the doctor and the doctor knows all kinds of things, and you just do whatever they say, and you're very passive in your patient-doctor relationship. And what I've learned is, no, I need to be actively involved. I need to do as much research as I can. I need to pay as much attention as I can. I need to keep records of everything and not depend on other people to do all these things for me. So, for me, once I realized there was a family connection and there were genetics involved, the thing that really scared me was then everyone else in my family is at risk. And until somebody gets a handle on, what's causing this in my family, let alone in the whole world, then more people in my family are going to go through the same sequence. And that made me very uncomfortable. So I decided that I needed to be the best educated patient out there. So I read every technical paper I could find, even though I didn't understand them. I went to every conference I could find, and little by little, I kind of worked my way in, and the COPD Foundation was kind enough to kind of adopt me and take me in. Mm-hmm. And it's been a great relationship for me, and hopefully for the foundation as well, that I get to talk to other patients who are going through what I went through in the very beginning. I get to show them that there is a process, that this is a manageable disease, and show them resources that are available to them. And then we help each other through the process. So it's kind of my therapy now, is to be able to help the next group.
Yeah, I love that. That's so important, to be involved in your care. So there's one thing if you go to a provider and they say, okay, take this medication, I'll see you in 6 months. And then you go back and the same thing, but really being an advocate for yourself and interjecting yourself into what is going on, what's happening, what medications am I taking? Why am I taking these medications? Do I need this test? What new things are out there? And really just being involved in your care is so important, and is really going to be the thing that produces better outcomes than just simply going along with whatever everybody says. So I absolutely think that education and knowledge is the key to success, and it is the key to having better quality of life. Once you were diagnosed, how did this testing help guide your treatment plan? So previously we have talked to Dr. Axman, and he's walked us through what a treatment plan looks like. And we'll have an episode on specifically treatment plan coming up. But he was mentioning that it's per person. So looking at what a person can fit into their daily lives, how active they are, and all of those things. How has your testing and treatment been designed by a doctor? How has that been cultivated for you?
Well, it is definitely a personal program, and it's adapted to how strong you are, how severe your disease or your infection is, what your lifestyle is. What are you willing to give up to work towards more long-term health? You can get by for the time being without doing anything, but then you're sacrificing, how long you'll be healthy overall. And unfortunately, we don't get to look in the crystal ball and know exactly what our outcome is. So I think it's wise that we do as much as we physically can, to preserve as much strength and health internally as we can. But some people are able to do more, and to be more proactive, if you will, in the process. And the thing that we always hear about, and I'm sure you'll talk about it more in other episodes, is the idea of this airway clearance, that the more I can clear out of my lungs every day, then the less bad environment I'm giving for a future infection. So it's an investment in the future, even though it takes up time every day. And that's, again, it's some people can do more and some people can't.
What does your day look like? So when you do your therapies, what's your regimen like?
Well, I try to get some exercise every day, be out in the world and do aerobic exercise, and I do a daily airway clearance. And then I have various medicines depending on whether I have an active infection or not. I'll have different medicines that I take. And again, part of my day is I do talk to other patients, and that, helps me keep my attitude in check, that, rather than feeling poor me, I can, realize that I've made progress and I can help other people make progress.
Yeah. So you mentioned being able to talk to other people. Bronchiectasis and NTM 360 does have a coffee break, which John leads, as well as Katie. Could you just tell us a little bit about the coffee break?
Yeah, this has been a great opportunity for us. On the second Wednesday of every month, it's 3 p.m. Eastern time for about an hour. Katie and I lead a discussion on a subject that's of interest to our patient group. And sometimes it's technical. We might have a guest speaker, who tells us something about the disease or something about treatment. Sometimes we learn about other things that might be helpful, whether it's nutrition or some other subject. And there's a couple times when we just have a social hour and we just talk to each other and find out we're real patients and real people. One of the interesting things about this disease is it's rare enough that you're usually the only person in your community that has it. So, you start having kind of a why me feeling, and what did I do wrong to get this when everybody else can still lead their life? So when you can start associating with other people and see what they've gone through and how they've overcome certain things, it's really helpful. So we have a good sized group that joins us every month, and we certainly welcome new people, both patients and caregivers, to join us.
Yeah. Do you feel that bronchiectasis and NTM lung disease, do you feel that it's limited you? Do you feel that you're not able to do things like you used to? Or do you feel that you're keeping up with all of it pretty well?
Well, I work really hard every day to be out in the world. I don't want to be just a patient. And my first couple of years, that's what I felt like. I felt like I was a science experiment. I had intravenous drugs, and I had all kinds of machines in my house, and they made beeping noises and all this stuff. I went for blood tests constantly, and I decided I'm not going to live that way. So every day I want to go do something. So I'm participating in, community events, whatever is important to me. I'm 15 years into this now, and I definitely don't have the stamina that I had when I started. Some of that may just be because I'm 15 years older, but I think it has probably sapped my strength somewhat. So I try to take my time and accomplish 2 or 3 things every day that I want to do that are fun to me, in addition to doing my medical requirements.
Mm-hmm. What advice would you give someone about undergoing testing for bronchiectasis for the first time? Is there anything that you wish that you knew before you were tested?
Well, I'd say don't be afraid of it. Follow your doctor's advice. But also, as you and I have referred earlier in this conversation, don't be passive about any of this. Be actively involved. Ask questions. Get copies of test results. Make a mental note of what's going on, and keep written paper records of everything. Because I promise you, 5 years or 10 years later, whatever care team you have at that time, they're going to want to know your early history. And if you don't keep those records now, it's up to your memory to remember it. And that gets really difficult after a while. So again, be your own best advocate, be actively involved. After my first treatment cycle, which was extensive, I remember the doctor saying, well, you're clear for now, so just come back when you start coughing up again. And I thought that wasn't an adequate answer. I want a program that works all the time. And, so both educating yourself, being involved with other patients, being involved with an organization like the foundation, doing daily airway clearance, those are ways that you can actively be involved in your healthcare.
How was your experience with shopping for a provider? So, you went to your primary doctor to get this kind of ball rolling, but do you feel that you shopped around for a doctor to find the perfect one for you?
Well, in the beginning, I was part of a healthcare program, so the doctors were assigned to me. And luckily, my very first infectious disease doctor, he was very intelligent. And one of the first things he said was, you have this rare condition, and I go to the seminars, I've learned about it, but I'm not an expert in it, and you need to have experts take care of you. And he recommended one of the best centers in the country, and he says, I don't know what it's going to cost you, but you need to go there. And I did. And that was a whole different level of care, because those doctors, they literally dealt with bronchiectasis and NTM every day of the week. So they got me on a good program. And again, once I cleared that infection, I realized I needed experts to keep track of me all the time. And so I actively searched out to see if there were clinical studies or, any kind of research projects where I could be in front of the smartest doctors in the land. And I did find one. And, for the last 11 years, I've been part of a study on the genetics of bronchiectasis. And I get excellent care from, one of the top doctors in the country.
That's great. Do you feel empowered by the knowledge that the testing provides, or do you feel sometimes that you're a little bit overwhelmed with all the medical tests and all the checkups?
It can go both ways. I think knowledge is power, and therefore I'd rather know as much as I can, even though I'll never know it as well as the doctors do. But at least I have a fair understanding of what's going on in my lungs and in my body. And I think that's important. And I'm not afraid to ask questions anymore. In the beginning, I had a fear of the disease because I didn't know what was going to happen. And now I do think it's manageable. And I know that if something new were to come up, I know how to find, the expert doctors. I know how I could go get better help if I needed it. Regarding the ambassador program, patients can contact us many different ways. We have a social activity feed on our website where they can kind of get involved in a chat function. We have email available that they can send us an email and we can answer it. And then we have an 800 number. I'll give it to you. It's 833-411-5864. And typically I answer that phone line. If I'm not there, then we have another person who answers it. And I'm happy to share my experience and compare notes with patients. We do have to make sure they understand that I can't give medical advice. I'm not a trained medical professional, but I've been around this group for a long time. So, we have a lot of things that we can share with each other. And sometimes I can help give them some direction as far as, how they might proceed in their case.
Well, thank you so much for joining us today, John. It's been really special to hear your experience and your story and how you got diagnosed and all those tests that you've done, and just really being able to help patients out there be able to go through this and know that they're being supported as well. So thank you so much.
Well, thank you, Alyssa, and thank you for all the work that you do with the foundation.
Thank you for tuning in to the Bronchiectasis and NTM 360 podcast. We hope that you found today's episode helpful and inspiring. You can stay connected by joining our online community, following our social media, and visiting our website for more resources. And of course, subscribe to this podcast and join us next time for more insight, stories, and tips to help you live well with bronchiectasis and NTM lung disease. Until then, thanks for listening and be well.